Blood clot in the lungs, prevention and complication. The recovery time for a blood clot in the lungs or pulmonary embolism can vary. People may need to stay in the hospital and take medications to prevent further clots for 3 months or more. This information comes from the American Lung Association. Most people make a full recovery after a pulmonary embolism, but some may experience long-term symptoms such as shortness of breath. Complications can delay recovery and result in longer hospital stays. In this video, we look at the rough time frames for pulmonary embolism recovery, how to help the body recover, and ways to reduce the risk of future clots. Recovery time for a blood clot in the lungs. The time it takes to completely recover from a pulmonary embolism can be several months or years, depending on the circumstances. However, people typically start to notice improvements in their symptoms once treatment begins. Usually, people can resume normal activities few days after starting medication. Any pain and swelling will also improve within this time. How long is hospitalization? The time a person spends in the hospital depends on how severe the clot is and whether the person's body is dissolving the clot on its own. Some people may not need to stay in the hospital at all, while others may require 1 week or more. A 2015 study looked at the length of hospital stay in 766 cases of pulmonary embolism in Italian hospital patients. While 19% of people with pulmonary embolism stayed in the hospital for 5 days or less, 17% of patients had treatment at home. A 2018 study suggests some people with low-risk pulmonary embolism may not require hospitalization. The study looked at 200 adults with acute low-risk pulmonary embolism. The study participants stayed in the hospital under observation for 12 to 24 hours before undergoing outpatient treatment with blood thinning medication. After a 90-day follow-up, no deaths or repeat blood clots had occurred. One participant experienced significant bleeding. Overall, however, participants reported a high satisfaction level with the care. How to aid recovery? Recovery from blood clots in the lungs can involve making some changes to a person's diet, lifestyle, and daily activities. This include exercise. People will need to speak with their doctor about when it is safe for them to exercise again after experiencing a pulmonary embolism and what types of exercise are best. According to the National Blood Clot Alliance, gentle exercise such as swimming and walking can be a suitable choice. If people are taking blood thinning medication, it is important they do not overexert themselves during physical activity. Diet. People taking anticoagulants may need to avoid certain foods that can interact with their medication. This includes foods that are high in vitamin K, such as leafy green vegetables, including collard greens and spinach. Beef liver, pork chops. People may also need to avoid alcohol, aspirin, and some over-the-counter sleeping pills, as this can increase the risk of bleeding. Because green leafy vegetables are a good source of nutrients such as iron and folate, People may need to get these nutrients from other sources. People can discuss this as well as possible interactions and side effects and anticoagulants with a doctor or pharmacist. Travel. According to the Society for Vascular Surgery, after a blood clot forms, the risk of further problems or complications is highest during the first 7 days. If people need to travel after experiencing a blood clot, they may need to wait a few weeks. A doctor can help decide when it is safe to travel again. During long journeys, people can move every 2 hours for at least 5 minutes and drink plenty of fluids to help with circulation. Preventing further clots. People can help prevent developing any further health issues or another pulmonary embolism by understanding their risk factors and taking care to avoid or manage them wherever possible. Risk factors include lack of physical activity over long periods of time, a family history of blood clots, cancer and cancer treatments, hormone replacement therapy or birth control containing high amounts of estrogen, pregnancy, smoking, being 55 or older, diabetes, lung or heart disease, obesity. To lower their risk of further blood clots, people can take the following steps: quitting smoking, reaching or maintaining a moderate weight by following a balanced diet and addressing any underlying causes of excess body weight, exercising regularly, getting up and moving around every 2 to 3 hours when sitting or lying for long stretches of time. If people have to undergo long periods of bed rest, they can take steps to reduce the risk of clots by wearing compression stockings or cuffs around the legs, raising the lower end of the bed so that the feet are slightly elevated, trying small movements to keep blood flowing in the legs, such as flexing and stretching the feet if possible, moving around as soon as it is possible. Complications. Most people will make a full recovery after a pulmonary embolism and do not experience long-term complications. However, some people develop post-thrombotic syndrome, which causes swelling, pain and skin discoloration, chronic damage to the lungs, or chronic thromboembolic pulmonary hypertension or CTEPH, a rare complication that occurs when scar tissue in the arteries blocks or narrows them. Further clots. Mental health conditions such as anxiety, depression or post-traumatic stress disorder due to the experience of having a pulmonary embolism. If a person notices any new physical or mental symptoms develop after a pulmonary embolism, they should discuss this with a doctor. A therapist may be able to provide support for people experiencing emotional distress. When to contact a doctor? People should contact their doctor straight away if they experience any signs of another blood clot, such as unusual swelling, often in one leg or arm, tenderness or pain in the leg, which may feel similar to a cramp, skin discoloration, which may appear red, blue or purple, an area of the leg or arm that feels warm to the touch. People should call for emergency services if they experience any symptoms of pulmonary embolism, sudden shortness of breath, sharp stabbing pain in the back or chest, pain worsening with deep breaths, rapid heart rate, unexplained cough or cough with blood and mucus. People should also seek immediate medical attention if they experience excessive bleeding, as this could indicate that their doses of blood thinning medication is too high. People with breathing difficulties 6 months after having a pulmonary embolism should speak with a doctor. This can be a sign of CTEPH.